Welcome back. Our next guest, Dr. Tarvinder Singh, who is a neurologist at Providence Regional Medical Center in Everett, as was our previous guest, Dr. Kimberly Costas. He's talking about strokes and prevention and intervention, and boy, Shannon, that's a big one there, trying to prevent those kind of things from happening before you have to ever worry about it.
Yeah, those strokes, prevention is huge, but also early intervention. And it's really cool. Providence now has this stroke intervention center right here in the North End. It used to be that patients needed to go into Seattle. Now, patients in Snohomish County, North Snohomish County, and you get early intervention with a stroke, you can prevent a lot of loss down the road.
All right, Dr. Tarvinder Singh and Shannon O'Kelly.
Dr. Singh, again, welcome back to Health Talk. We've had you on before talking about kind of your program, and you're a interventional neurologist or a vascular neurologist. I just want to talk about what you do, what your practice is, and your training before we get into kind of the nuts and bolts, and that's kind of stroke awareness, intervention, causes, and treatment, all the neat things we're going to talk about. Tell our listeners about your background and your training.
It's always a pleasure to come here, Shannon, and thank you so much for inviting me again. I am the medical director of neurology program at Providence Hospital in Everett, and I'm a vascular or a stroke neurologist by training. And I've been doing this here for the last 5 years, and we've been growing the program. We now, just this year in January, started in-house stroke interventional program, where we'll talk a little bit more, but it's a really exciting and the state-of-the-art treatment that is available for our stroke patients.
Yeah, stroke, you and I both know, being in kind of the medical business, you being a neurologist, a vascular neurologist, myself being a physical therapist, we both can appreciate how important it is to recognize a stroke or the early symptoms of a stroke and get early intervention depending on the cause. But let's talk about the signs and symptoms of a stroke. Maybe you can just review that for our listeners.
Absolutely. For stroke, it's a little tricky, right? There are so many possible manifestations of stroke. So the American Heart and Stroke Association has made a mnemonic that we talk about with our patients, and it goes by BFAST, and it's BEFAST. And this is just an easy way to remember the symptoms that are associated with stroke. And the B stands for balance problems, E stands for eye or vision problem, and then F stands for face weakness, A stands for arm, but also leg weakness, S stands for speech changes, and then T is the final thing, which time is critical. And that if you have any of these symptoms that suddenly started, you need to call 911 and come in, because time is brain in stroke world. Every minute that we wait theoretically causes 2 million additional brain cells to die. So it's really, really important to get patients in early, yes.
What are the common causes of a stroke? The stroke is, happens in the brain, and you're blocking or eliminating blood flow to healthy tissue. That's why time is so important. But what are the causes of strokes?
Thank you for asking that. Yeah, it's really important because about 25% of the strokes are recurrent strokes, right? So if someone comes in and we don't find out the cause, then we cannot prevent these additional strokes from happening. So for us, as soon as the patient comes in and gets their sort of initial treatment, our main focus becomes to find out what the cause is. The main things that cause stroke are plaque in blood vessels that supply blood to the brain. And when we find it, our focus goes on taking that stuff out so the vessel is open again and can supply blood again. The second common cause is what we call small vessel disease. These vessels are so tiny that barely a few blood cells can pass through it. And then the third very common cause of stroke is what we call cardioembolism, or it's where something happens in the heart which causes it to make a clot that then travels up through the blood vessels and into the brain and then cause blockage and stroke. So, and the most common cause there is arrhythmia called atrial fibrillation, which many people are familiar with. And then the fourth one is more than 300-400 different types of diseases that can contribute to stroke.
Is there any time you just can't find the cause of a stroke?
Yes, Shannon. About 1/3 of the strokes, we never find the cause, and that is the frustrating part and the area of research.
More with Dr. Singh and Shannon next on Como.
It's a Northwest Lifestyle Weekend on Como News. IRG's Health Talk continues.
All right, we're back with Dr. Tarvinder Singh. We're talking about preventing strokes and intervening in case of a stroke, and here's more of that conversation.
Dr. Singh, again, thank you for joining us on Health Talk. I mean, again, I always enjoy talking to you. Such fantastic information. Okay, let's talk about this this interventional center that you have at Providence. I mean, right now, people in Everett, Snohomish County, the north end of the Puget Sound now have access to this fast interventional treatment. Tell us about your interventional treatment of these symptoms or strokes.
Right. So when someone comes in, they have a clot in the brain that is causing their symptoms. Our job is to figure out either to medically dissolve the clot or to take it out. In terms of medical treatment, that has been there since 94, 95, and it's a IV medication called Eltaplase. You give it as soon as you can, and we are sort of one of the fastest hospital in giving that medication in our hospital system. And a majority of, like 1/3 of the people who get this medication clear out their stroke and get better. However, if the clot is large, it's a big blockage, then it doesn't give enough surface area for the medication to work and dissolve it. And that's where this new treatment that we started this January helps. It's called mechanical thrombectomy. It's a big name, but basically it's a catheter that they take it up through a vein, either through the groin or through a vessel in the arm, and take it all the way, needling it all the way through all these blood vessels to the point where the clot is, and they literally suck it out with a vacuum-like device and clear the vessel. And as you can imagine, if you can take out these large clots, the outcomes from these is miraculous. We have patients who get completely better with these treatments, whereas before this treatment was available, they would be paralyzed and disabled and never be able to, be with their families or do what they were doing in the past. So the data is, done through very large trials, shows about 1 in every 2 patients who get this treatment get better and able to get back to their almost close to their normal life. Very, very excited to have this treatment available.
I just wanted to say how amazing this sounds and how amazing this is to have this procedure or ability to have this procedure here at Providence in Everett in the North End. I want our listeners just to appreciate the circulatory system of your human body and to be able to feed a catheter up there and then pluck that clot. That's amazing. But you're doing some real quick test to identify where that clot is, and this is pretty fast. Are you on call at the ER at all times?
My team is on call for the emergency department, and the interventional neurologist and neurosurgeons are on call for doing this procedure. It's a huge team of people, Shannon. There's a ER doctor, there is a neurologist, there is a intensivist, there are this procedure suite technicians and team. It's like a huge team that comes in and assembles together anytime we have a large clot causing a stroke. And it's amazing feat of process that makes it happen day and night, 24/7 in the hospital.
That is amazing. Dr. Singh, we are out of time, unfortunately, but I'm always amazed when I talk to you. I so appreciate what you do and your team does and just the benefits that the public need to be aware of. Strokes are tough, can be tough to recover from, but if you be fast, get in. Thank you for your time.
My pleasure. Thank you, Shannon.
You've been listening to Dr. Tarvinder Singh, neurologist at Providence Regional Medical Center, providence.org for more information, Shannon.
Yeah, it's a complex situation. If you have a stroke, it can lead to a lot of functional loss, but preventing and early intervention is so important.